We told the family, stay away so that we can keep your loved ones safe. And then, quite frankly, Libby, we abandoned them. We did not protect residents.
We have been trying to get it through their heads that change is needed desperately in long-term care, and look where we are today.
Right now, the focus is on what do we need to do today to get through this pandemic and save as many lives as we can.
50% of deaths in Canada have happened in long-term care, so people are rightfully worried.
From the Zoomerplex in historic Liberty Village, the Zoomer with Libby Znaimer.
Welcome to the Zoomer. I'm Libby Znaimer. It's a tale of two pandemics. In the community, COVID-19 is coming under control. But in long-term care, it is spreading like wildfire and killing our elders at an alarming rate. It's a toxic mix of vulnerable residents in close quarters with overworked and underpaid staff who had often been working at multiple facilities without proper protective equipment. It's leaving loved ones frantic with worry about their family members. We'll discuss the many problems facing the system, but before we dive in, let's tee up the topic.
The coronavirus has invaded over 600 nursing and retirement homes across the country. And with now more than 1,000 COVID-19 deaths reported in Canada, half stem from outbreaks in long-term care. According to the latest numbers, 16 homes have lost at least 10 residents to the virus. Much worse, we saw it coming. Early data from Italy, Spain, France, Ireland, and Belgium showed that between 42% and 57% of deaths from the virus happened in long-term care homes. So, were we slow to act, or were the measures put in place wholly inadequate?
There have been issues in long-term care homes for years, everything from residents getting bed sores because of improperly cared for wounds, to lack of proper cleaning of facilities, to infection control violations. Should more have been done months ago to prepare for how hard these homes would be hit? Let's start with Doris.
Thank you, Libby, and thank you for such an important discussion. Not months, but years. RNO has been speaking with government after government, minister after minister, for the last 10 years, from Deb Matthews and all the way now to Minister Fullerton and everybody in between. Staffing, the funding formula that is used, all is archaic and all is to the detriment, Libby, of the residents, their families, and the staff that work in those organizations.
Miranda, we've also been talking to you about that for years, and we have this terrible shortage of personal support workers.
You're right, Libby. This has been a constant issue in long-term care. Turnover of staff is big, not having enough personal support workers on the floor in order to care for our residents. And really, frankly, it boils down to no ratios, no one PSW to a certain amount of residents. This is, again, I agree with Doris, we have been talking since Deb Matthews, 10 years, trying to get it through their heads that change is needed desperately in long-term care. And look where we are today. It's sad.
Marissa, I mean, when I talk to the minister, she says change was underway when the pandemic hit. Do you buy that?
No, and I think what's most important to know is that you would be wrong to presume that many of the issues we're seeing today in homes are as a result of COVID-19 because these homes are overwhelmed by it. In fact, it's not true. As your last two guests pointed out, many of the issues are perennial: staffing shortages, training shortfalls. Before COVID, there were still countless stories of people ending up in the hospital because of lack of food or water, people dying of dehydration or UTIs, even a story of a woman in a BC long-term care home confined to her room infested with bed bugs for 2 weeks. So we hear these stories all the time, and what COVID-19 has really done, I think, is exposed sort of the fundamental weaknesses in the way that we deliver nursing care in Canada.
Dr. Heckman, what's your perspective on this?
Bill Gates has been speaking about this for years. Pandemics are going to happen, and we've known they were going to happen for a long time. And you thought we would have learned with SARS and H1N1 to do something, but obviously we haven't. And so I appreciate that changes may have been beginning this year or late last year, but this should not be a surprise to anyone that we have a pandemic. And I also agree with the speakers. We have structural issues, funding issues in long-term care that, again, have been present for years. We have known that these are fragile residents. This is shocking that it's happening, but it's not surprising.
Libby, we advise quite different than what's happening. If you look at our communications with government and even publicly, first of all, we said, absolutely, we need to attend to nursing homes. We need to give them the surgical mask because we knew that the individuals, the residents in nursing homes will not have a chance to live otherwise. So our only line of defense was to keep them safe. We told the family, stay away so that we can keep your loved ones safe. And then, quite frankly, Libby, we abandoned them. We did not protect residents, not PPE, testing only after an outbreak, et cetera, et cetera, et cetera. Even surveillance testing still is being talked about, but it's not happening.
You know, it's interesting, David. I was very surprised that there is capacity in the hospital, and the hospitals were able to clear space and come up with all these negative pressure rooms because the hospitals were also at or over capacity before this started. And then I learned that residents, before this hit in the hardest way, were moved from hospitals, if they were just there waiting for a bed, into long-term care. Now, it's hard to blame authorities for doing this if they were, watching what was going on in Spain and in Italy. But I don't know, is that going to turn out to be one of the big mistakes?
The hospital situation is North America-wide. The headlines have been overflow, going to be swamped, but the reality has been that all the hospitals have not seen a surge that was anticipated. They all have more ICU beds than was anticipated. I don't know yet whether that was because they estimated wrong, or are we going to find out afterwards that a whole bunch of very sick people never made it out of their homes into the hospitals for other reasons. I mean, sick people with other illnesses or complaints. But the idea that you're moving them into a more dangerous environment in some ways to make room for a surge that doesn't come is certainly going to attract a lot of very agonizing second guessing when this is all over.
Okay. Coming up later in the show, I speak with the Minister for Seniors, Deb Schultz. There's more after the break.
The government was not prepared. We knew and we've known that the long-term care sector was not equipped to deal with, well, basically anything.
Welcome back. One of the hardest hit long-term care homes in Ontario is the Eatonville Care Centre, where at least 32 residents have died and more than 130 have tested positive for COVID-19. The relatives of numerous residents have complained about a lack of information and any sort of contact with their loved ones. Recently, Norma called into Zoomer Radio's Fight Back. She has a brother who is living at Eatonville, and she was struggling to find out if he had been tested for COVID-19 after his roommate passed away. Here's what she had to say.
We need to know if he was tested, even for someone to say they're waiting on the test results. The executive director does not answer the messages. I know she's overwhelmed with lots of people to call back. But just to say yes or no, I can't sleep at night knowing my brother is receiving no care, and whether he has been infected or not, I don't know.
She's got an update for it, which I'm very anxious to hear. Has he been tested, Norma?
Yes, one of the DOCs, the director of care, called and said, I have good news for you. Your brother's results is negative.
Oh, thank God.
And that's what I could just squeal. And I said, thank you so much. But do you know if he's gotten any care, she says that's in the hands of the charge nurse. But the charge nurse did call yesterday, so at least I know he's looking partly like a human being and he's not positive.
Fortunately, in Norma's case, her brother's situation improved greatly after her story aired on our show. Stories like Norma's prompted us to send Z News videographer Darren Maharaj to the Eatonville Care Center.
The Eatonville Long-Term Care Center here in Toronto has been struck hard by the coronavirus. In fact, close to half the cases in the country are in LTCs like this one. And with over 32 COVID-19 related deaths, this home now has the most in Ontario.
I received a call from the nurse practitioner here the day before my mom passed away. So I was able to come in and see my mom. I got all the gear necessary and everything. Everybody was extremely compassionate, very helpful. And I was able to say goodbye to my mom. And I'm here today to pick up her belongings and wheelchair and everything she had here.
What are your thoughts for the people that have loved ones in here that are going through similar situations?
I think they have to be patient. They have to leave themselves in the hands of this beautiful, amazing team of workers here.
Among the team members is Audrey Douglas, who has been a personal support worker at Eatonville for 18 years and says she feels for the PSW that recently passed away at a home in Scarborough.
It's heartbreaking because she goes to work every day to help other people. We have all kind of precautions in there, and we have all our PPE, so we don't do a resident without our protection. I come to work every day. I don't take a day off. I don't take my weekends off. I work straight because they need me in this time more than ever.
Thank you so much for what you're doing.
Thank you.
For the latest COVID-19 news and facts that you can trust, visit carp.ca. In Toronto at the Eatonville Long-Term Care Center, I'm Darren Maharaj for Zoomer News.
So, is enough being done to keep families connected to their loved ones? And are these long-term care homes doing enough to keep families informed? Doris?
So let me say that the situation in Ethan's home is not the worst as we speak now, because Orchard Villa, which today came into the news, already has, I believe, 32 people that have passed away, and very little was known to the public. So there are other homes that are on the red, so to speak, with fires going on that is not being disclosed at this point, perhaps. And I think that's one of the key pieces for the public, is to demand transparency, because the authorities know about these homes and the families have a right to know. Is it enough done to keep families engaged and involved? In many of the homes, yes. But when you have a situation of a major outbreak, it's more difficult, of course. Let's remember there are 650 nursing homes. The outbreaks are in about 130 nursing homes and about 65 retirement homes. So many of the homes are doing very well. Let's keep that in mind. They build surge capacity in terms of staffing ahead. As soon as they heard that an epidemic even was coming, when was a pandemic, they built even more. We know, Libby, because we have the VIA nurse, and we have been on the forefront of providing both RNs, nurse practitioners, and also nursing students that after the second year can work as PSWs. So many of the homes, we have served at least 200 homes, and those then have the resources that they can connect and keep families connected more, and residents better and better attended to. Healthcare professionals and workers in general in the homes are trying to do heroic work. We need to just provide them with the resources that they need.
Dr. Heckman, Doris is saying that the authorities know about outbreaks in homes, that it's not all transparent. Is that just a lag in numbers, or is this an endemic problem in the system?
Oh, information is always hard to come by, and information is always delayed. And we do have information systems that exist, but for certain things like this, I think it's a problem. It's a problem because in many ways, we rely on the nursing home staff too much to do all of this extra information collection. And right now they're swamped. And we don't have existing infrastructure to facilitate information collection in a way that could help us know what's going on very quickly. So part of it is structural.
Well, yeah, Marissa, I mean, that's what I've been told, is that when there's a crisis, they'll care for residents before they will update family. Is that acceptable?
Well, I mean, in a pandemic, I think what is paramount is that we put the needs of the residents first. So yes, having said that, your heart does break for family members that are terrified for the health and safety of their loved ones in these homes. So I think that transparent communication is so important, particularly during a pandemic. And to Doris's point, she is right. A lot of homes have coped well during the crisis, but then there have been many other homes that have really struggled to deliver even minimum standards of care. And that's just so unacceptable. So when we talk about, government preparedness, were they prepared for something like this when we knew, when we saw it coming from overseas, from Spain, Italy, France, but also we've had other pandemics in the past. Governments really have a moral responsibility to make sure that our most vulnerable members of society were cared for and are taken care of. And I'm not sure that they delivered on that.
Miranda?
I think that, the current situation in long-term care homes, I know that the staff is doing their best to take care of the residents. They do put the residents first. Unfortunately, families are the victims of that situation. I know here at the association, we receive phone calls from families every single day, and they're asking questions about, what does a PSW do for my loved one in long-term care? How can I reach out to my loved one in long-term care? I mean, it's heartbreaking, really, truthfully. I even heard about a long-term care facility that was sending out an automated message to all family members, and they were stating how many deaths were at the home and how many COVID positives were at the home. Do I agree with that? No. Do I understand why they would do that? Absolutely. But, it's like Marissa just said, the government was not prepared. We knew and we've known that the long-term care sector was not equipped to deal with, basically anything at this point. And so could they have done a better job? Absolutely.
Okay. There's more after the break. Stay with us.
Why do I want to put a loved one, or why do I want to have a loved one remain in a situation where the home is inadequately prepared to deal with it?
Welcome back. Here in Ontario, in addition to sending teams into long-term care homes, the province has asked the Army to assist at the 5 hardest hit facilities to try to help. In Quebec, where the situation is more widespread, the military has already been deployed. Meanwhile, many family members are wondering if they should be taking their loved ones out of nursing homes to keep them safe. Dr. Heckman, do you think that would be a good idea?
I think for most people, their loved ones are in nursing homes because they have needs and problems with dementia, chronic illnesses that make their needs overwhelming for the family members. And I think some family members might have just recently placed someone in a nursing home, and maybe they've got a bit more time now that they're off work because they don't have to go to work and they might have that bandwidth. But for most people, most residents are in nursing homes because they have really significant healthcare needs. If we had a home care system that was also robust, and I'm sure that that's another interesting area of discussion here, then we would be able to support these folks at home a little bit more than we can. But right now, I think the prospect of taking somebody out of a nursing home and looking after them yourself when their needs are quite significant is not available for most people.
Mm-hmm. Yet a lot of people are thinking about it, David.
I think it's a very rational decision to approach, because why do I want to put a loved one, or why do I want to have a loved one remain in a situation where the home is inadequately prepared to deal with it, and where we're dealing with an infection that is an unknown. Is it going to spread? Is the person going to catch it or not? So I think it makes a lot of sense to look at it. Unfortunately, with all of these topics, there's so many different individual variations between bring the person home for a while versus leave them. And what are these other needs? What are these other medical needs? As the doctor quite rightly says, am I equipped to deal with it in my home environment or not? And it's a very understandable thing that people would want to do. And I don't think one size fits all.
Marissa, I think this has changed, but I know that at the outset, people who were thinking about taking their loved ones out were told, okay, but if you do, you will be going back down to the bottom of the waiting list. And those waiting lists are years long now. I think that's been changed, at least here in Ontario, but it seems like it was a roadblock.
Let me start maybe by saying that I think that it's unfair that our system would even download that onto families. But we are in the situation that we're in. And I can tell you, we've received countless calls from CART members that are concerned about their loved one's safety in homes and are fearful that if the home does have an outbreak, they won't be able to pull that person out. So many people are taking proactive measures to do it. It is true that a lot of people don't have capacity to meet the care needs. And so for them, that is a conversation that just is right off the table. But for some people who do feel like they have the capacity to meet the care needs of that loved one at home, even temporarily, you're now taking on the full load of their care responsibilities. You'll be responsible for their medication and so on and so forth, getting that from the pharmacy, because homes aren't equipped to take care of people outside. So there are a lot of factors that people need to consider. It's a very individualized decision, but it is something that many people are grappling with just because of that number. 50% of deaths in Canada have happened in long-term care, so people are rightfully worried.
Miranda, you're nodding.
I am. I actually, a personal story here, both my grandmother and my grandfather, my family decided to pull them out of, they were in retirement home residences, two separate ones in Brant County. My grandmother is 100 years old.
Wow.
And went to stay with my aunt, who is a former registered nurse. So that worked out on that side. And my grandfather is 91 years old, and he was put into the family cottage, which is next door to my brother. And so my mom and dad are there every day, caring for him. They're both fairly independent, thankfully. But what we're hearing, though, is loved ones are just struggling so much so with whether or not to take them out of the home. We've had people call the association, and we've actually advised against it in certain circumstances because, like Marissa said, they didn't have the setup. They lived in a condominium. They didn't have the wheelchair access. They didn't have the ability to hire, personal support workers to come in. Then we had frustration from families saying, I have my mom or dad home with me now, and I can't get a personal support worker to come in. There's no PSWs. And the reason for that, Libby, is because the majority of them have redeployed back into long-term care to help on the front lines.
Do you know of people who are working both in the community and at long-term care?
Not anymore. Now they've chosen. So at one point before Premier Ford put that order down stating they had to choose one place to work, many of our personal support workers opted to stay either in community or in long-term care, but not in both.
Okay, that's interesting because I thought that order just affected long-term care facilities, but it's not mixing the community and long-term care, which actually sounds sensible.
Yes, it is. Makes tons of sense.
Okay. When we come back, my interview with the Federal Minister of Seniors, that's next.
You've seen one pandemic, you've seen one pandemic, because they are all unique and they have their own challenges. And this particular virus has brought with it unique challenges in how it's presented itself and transmitted in the community.
Welcome back. There have been a lot of questions surrounding preparation and response to this pandemic, particularly in long-term care. And even with federal financial aid announced for workers in those homes, it's still not clear how quickly or not those funds will reach those in need. I sat down with the Federal Minister of Seniors, Deb Schulte, to discuss. Take a look. You've said there's no playbook for this.
What I said was there may be pandemic playbooks, and there has been one. Dr. Tam made one, I think it was in 2006.
Correct.
But the issue is this particular virus is not operating the same as other viruses. So as she has said herself, you've seen one pandemic, because they are all unique and they have their own challenges. And this particular virus has brought with it unique challenges in how it's presented itself and transmitted in the community.
But there were suggestions in that pandemic preparedness that looked eerily relatable to this pandemic. And it also underlined problems. So for instance, talking about what should be in the national stockpile. In 2010, the Auditor General's report underlined failings in the national stockpile. So it looks like between the time it was written after SARS and the time that this hit, there just was no will to follow through on what was in that preparedness report.
So, there is definitely lessons to be learned, and that will be obviously informing the future and how we move forward. But right now, the focus is on what do we need to do today to get through this pandemic and save as many lives as we can.
One of the questions it brought up, the fact that people were moved from hospitals to long-term care, people who were in hospitals waiting for long-term care, is that if they could move them before the pandemic, how come it didn't happen before when the hospitals were at 100% plus capacity?
Again, this is provincial and territorial jurisdiction, how they manage their resources. I think these are things that are going to inform decisions going forward as those discussions unfold. But I'd like to bring you back to sort of what we need to do right now. I think there's a lot of discussion about the future, but right now we are still seeing the impacts of what's happening in long-term care facilities. There's a tremendous amount of work to be done. Just to let you know what the federal government did, early days, we moved $500 million into the provinces and territories to help them deal with this pandemic. We've also offered the provinces and territories some funding to be able to do a top-up.
I wanted to ask about that because here in Ontario and other provinces, personal support workers can no longer work in one facility. That is in effect now, but the money, the top-up, the provincial government says we're waiting on the feds. You've just said you're made the money available, but in the meantime, for those workers who do not make very much money, that's their grocery money that they lost. So what is taking so long to get that money to them?
Well, as I said, we don't have the mechanism at this moment through payroll to pay. That's a provincial and territorial matter. So what we can do is offer the opportunity. It is matching funds. There's a ratio involved in it, I believe, and so I think it's under discussion. I know it's under discussion. So this is something that it's being worked out right now.
Is there an ETA for it, for when those workers can expect a little cash?
I'm saying it's actively in work right now, so we'll see. Stay tuned. I expect something soon.
All right. When we come back, we'll hear what our panelists think about what Minister Schultz had to say.
So there are learnings that we really need to take on if we are going to transform the system for good times and for also difficult times like the pandemic.
Welcome back. Before the break, I spoke to Minister of Seniors, Deb Schultz, about what the federal government is doing to help those in long-term care. She acknowledged there was a pandemic preparedness plan which was not well followed, but she said this case was different. Is that explanation valid, or was it just a matter that the sense of urgency lapsed in the time between SARS and COVID-19? Let's begin with Doris.
While I respect the issue that a pandemic is a pandemic and not all pandemics are the same, many of the learnings from SARS have not been enacted. Take, for example, the issue of staffing. We have been talking about staffing for the last 10 years at RNO, specifically in nursing homes and other sectors. Take the issue of home care. We basically, during the pandemic, shut down home care. We were talking before about could that help residents to actually be at home if loved ones feel prepared to take them home? Absolutely. We shut down. We focused so much on hospital care that we forgot all the other sectors, and that's national. That's not only in Ontario, that's across the board. Take a different approach to it. The Balearic Islands in Spain. Spain overall had a very difficult situation. Balearic Islands are doing fantastic. Their entire approach was primary care and home care, not hospital care. So there are learnings that we really need to take on if we are going to transform the system for good times and for also difficult times like the pandemic.
Dr. Heckman?
I totally agree. We had a great pandemic plan, I guess, for acute care. And that was it. And most people do not live in hospitals. They live at home. They live in nursing homes. And, there's a fundamental issue with our system, which is focused on acute and reactive medicine, when in fact, people have lived longer with chronic disease. And chronic disease is a problem, except that we can anticipate when it's going to run into problems, and we can shore it up. As Doris mentioned, if we had more robust home care, if we had a system focused on primary care, if specialists were not so hard to access. I mean, I'm a geriatrician, and most of my colleagues work in hospitals, whereas most seniors don't live there. And so we've had a system that's been fragmented and not geared towards the management of people with chronic issues. And now COVID has happened and our hospitals are doing okay. But the rest of the situation in long-term care and retirement home, I'm very worried there too, is not so good.
Miranda, you heard what Deb Schultz had to say about the money. Last week, I was talking to the provincial minister of long-term care, and she was saying, she wished it would have happened yesterday, but there are processes that have to be followed. So the jurisdictions seem to be pointing at each other. In the meantime, your members are out quite a lot of money, I would imagine.
Libby, I could just hug you for bringing that up. We hear from our members every single day asking, even just before I came on here today, asking about, so when are we getting this top up? Are we going to get a top up? I don't want to stay. I mean, as we all know, personal support workers are notoriously unregulated. They don't make good money. And yet here we are saying to them, stay in the job because now you are suddenly essential. We need you in this job. We need you to risk your life and that of your families to care for our most vulnerable. 90% of the PSWs will stay and they will do their job because that is what they do. Personal support workers, they are a passionate, loyal, and just an amazing bunch of people. So they will stay to take care of their residents. But what are we doing for them? That's what we have to ask ourselves. What is the government doing for them? Great, you thank them on TV, you thank them in letters, and we appreciate that. But thank yous only go so far. Now we need to see some sort of a top up, some sort of an incentive for personal support workers in long-term care so that they stay. We were notoriously short-staffed before the pandemic. I'm really nervous about what it's going to be like after.
Yeah, and it's some people are referring to it even as hazard pay, even just for now, because again, when I look at what they earn and losing 4 or 6 hours, I mean, again, that's that's not for any luxury.
No, and and I agree. Even if it's just for the time of the pandemic, that they give them hazard pay, as some of our PSWs as well have been referring to it as. But then when this is all said and done, we really do have to relook at the personal support worker profession and how we're going to make it into a profession of choice at that point.
David, how would you critique, if you would critique, what the minister had to say?
Well, I think that everybody's scrambling. Everybody's got an answer at the moment. This thing comes in out of nowhere. So you can expect it to be messy. But I'm with the previous speakers who have said, where were you before? And I do want to raise one angle that I think was important. We just heard about, what happens afterwards. Are we happy with the system? Let's say there was no pandemic. with one shower for 25 people in some homes, with one bathroom for I don't know how many people. The minister talked about infection guidelines. Well, how robust can these guidelines possibly be if they're cobbled together under the threat of this pandemic? What were they before? How many of the facilities are allowed to operate as hotbeds of infection even without coronavirus? Are we happy to have our most vulnerable people in a system where the workers are asked to take on enormous risk and be underpaid, where the facilities are aging, half of them at least need replacing, where the inspections and the regulations are either inconsistent or contradictory or impossible to figure out? Surprise, surprise, okay, coronavirus is opening up our eyes, but why did we even let it get this far in the first place?
Marissa?
I just couldn't agree more with what everyone else has said, and especially Miranda, when she spoke about the need for a strategy to not only acquire talent, but retain talent. That is one of the biggest challenges we're seeing in homes right now. And it doesn't take SARS or any other crisis of similar scale to know that that's a crisis or that's an issue in our long-term care homes. So we talk about lessons learned from SARS. Yes, our hospitals were prepared. They did learn lessons. They did have protocols. Many of the staff and patients were being tested. Personal protective equipment was prioritized for hospitals. Why didn't we do the same thing for our long-term care homes? There's so many things that we could have done better. And it just feels like our long-term care homes were an afterthought in all of this.
Okay. We need to take a short break. When we come back, final thoughts from our panelists. Welcome back. It's now time for final thoughts from our panelists, starting with David.
Libby, I was on the radio with you the other day when Norma called in. I was so happy to hear the update that was positive, but she pointed out that there were, I think it was like one shower for 25 people. Her brother had not been bathed or shaved in days and days. So what good are these guidelines that the minister talked about as if it was some accomplishment to send out guidelines when the underlying system is so inadequate? Are we happy with this without this pandemic? Do we think it's any good? Oh, we don't have the pandemic and therefore it's fine? It's not fine. And I think we have to really pay attention to what we've got there, even absent coronavirus doesn't suddenly make it worse. It maybe accentuates it, but it was bad all along.
Marissa?
I think in moments like this, what's broken in society gets revealed, gets exposed, and long-term care has really been laid bare for all to see. What we need is urgent government action to safeguard our vulnerable elders in long-term care homes. We need minimum staffing levels. We need training and support for staff, improved pay and benefits for the workers. We need even things for a pandemic, increased isolation space, rapid testing, protective equipment for staff, and most importantly, from our governments, we need a commitment to eliminate, to eradicate harm in long-term care.
Dr. Heckman?
I want to echo something that Doris mentioned earlier, which was most homes are doing quite well. And I think that's a testament to the people who work there. They're dedicated, they love what they do, they're very good. But it's a broader issue of care for chronic disease, geriatric care. Long-term care is the frailest, it's the most vulnerable, but retirement homes, shelters, home care, even hospitals at normal times when they're dealing with older folks with complex problems, they don't do a good job. This is a major issue about our relative inability to look after an aging population, and it will have to change.
Miranda?
I just want to take an opportunity to really point out the fact that the personal support worker who was the invisible worker for so long, doing the job on the front line in long-term care, has recognition. It's important that us as a society recognize the vital job that they do day in and day out for society's most vulnerable individuals. What I would like to see happen past this pandemic is self-regulation for the personal support workers, recognition of the PSWs, of course, but also set ratios in long-term care. I'd even like to see more nurses in long-term care. We need to really look at the staffing issues, the retention of staff in long-term care, the training surrounding infection control. I think that we should always be prepared for a pandemic, regardless of whether or not we think one is coming.
Doris?
The whole system of care of the older person needs to be rethought. This is not the way it's in most European countries. If you look at Scandinavia, it's much more a living, a city environment. We really need to rethink the way we do this. Ontario Health Teams is a good beginning. So they were put to test and they're performing. We are in many of the leadership tables as we speak of Ontario Health Teams, and they're delivering more than those organizations that are not in it. But we need to rethink that it's about enhancing community care that will be the solution for pandemic and not pandemic. Now is the time, let's take advantage of the silver lining, which is COVID, as many said, really showed the cracks on the system. Let's now to take it on to first save lives on the time that is left in nursing homes, in shelters, in correction facilities, in our indigenous community sisters and brothers, in all other congregate settings. And then once this is over, let's move from saving lives to saving the system for a better future.
That's all the time we have. The pandemic has forced us to confront long-standing problems in long-term care. My hope is that it will finally make us take the action we must to change the way we treat our elders for the better. Thank you for joining us. See you soon.